Okay, guys, so we're going to talk about immune system medications. This is Mrs. McGhee, and this is the lecture that we would have had in class, but we've been out for severe cold situations. Pathogens that we're going to be talking about fighting include bacteria, viruses, parasites, and fungi. These are just descriptions of each of them. You can read these yourself. Viruses, parasites, and fungi. An overview of what we're going to be learning is infection medications as well as HIV medications. In another video, we'll be talking about vaccinations, which will be on this test also. Antimicrobial therapy can either be to treat an infection or it can be prophylactic, and prophylactic means that we're going to be preventing the infection. Peak and trough we'll talk about on another slide here in just a second. And lab tests that are related to infection include peak and trough, gram stain, and culture. A gram stain identifies organisms that we want to treat. The culture used if the gram stain doesn't identify the microorganism, and we have to get the gram stains and cultures before antibiotics are started or it won't be accurate. So here is a picture of a gram stain. Obviously this part is not real, but this is what it would look like under a microscope. The gram positive bacteria or microorganisms actually absorb the purple dye, so they are identified, and then gram negative do not, so they can identify them in that way. But that's what it looks like and how they identify them. Peak and trough, those are lab values once you're already on a medication. The peak is the highest concentration of the antibiotic in the bloodstream, and a trough would be the lowest concentration of it in the bloodstream. This is so that they can time the doses of the antibiotics properly to prevent toxicity. If they are taken correctly, if the blood is taken at the correct times, they identify toxicity levels before it gets dangerous for the patient. So prevention of infection, this should be a review for you guys. Hand washing is the key to preventing all infection. Invasive means that you can have any procedure that's invasive causes an increased ability of an infection microorganism to enter the body. Make sure that you know that all antibiotics should be taken the entire prescription. If it says 10 days, they need to take it for 10 days. This prevents medication resistance and reoccurrence of that particular infection. Here is the chain of infection. We have gone over this before. I just wanted to review it with you. Pathogens invade the body through routes such as like respiratory, GI, or even the skin. And once they enter the body, the immune response is then activated, and that causes the signs and symptoms of inflammation that you guys are familiar with. But signs and symptoms of inflammation include fever, swelling, pain, redness, heat, and possibly fatigue. The goal of antibiotics is always to decrease the pathogen population to a point that the body can control it itself. So, types of antibiotics. Antibiotics is a general term. It can mean antibacterials, antimycobacterials, antiparasites, antifungals, and antivirals. So, all different kinds of microorganisms getting murdered by these antibiotics. Antibacterials. So, these are antibacterials bacteria. So they're killing all the bacteria. And there's hundreds of different kinds. We're talking penicillin, cephalosporins, monobactrims, carbapenems, vancomycins, tetracyclines, erythromycins, gentamicins, fluoroquinolines, sulfamides, and urinary tract antiseptics. Our first one that we're going to talk about is penicillin. Penicillin is one of the oldest medications. Can be given for gonorrhea, peritonitis, UTI, pneumonia and respiratory infections, septicemia, which is sepsis, and meningitis. It works as a bactericidal, so it can actually kill the bacteria. When you kill a bacteria inside the body, all the toxins have to go somewhere, so you can have some GI distress, a rash. Very often people have anaphylaxis and an allergic situation related to penicillin, but these antibiotics can also affect the oral cavity and cause the good bacteria to go out of the oral cavity and allow yeast to grow there. Fluoroquinolines. The particular medication that we're going to talk about in this group of medications is ciprofloxacin, also known as Cipro. And these, it says, for those hard to reach chronic bacterial infections. So bacterial infections such as urinary, respiratory, GI, bone or joint, and even eye infections you can give this medication for. You can read how it works. It's telling you that it inhibits the DNA so that it can't wake. But some of the side effects include nausea, diarrhea, dyspepsia, so that is acid reflux, vomiting, constipation, flatulence is gas, and confusion. And remember, this one is, it's possible to cause a super infection because of it, and it can lead to worst case scenario is a case of C. difficile. You can assess the client for hypersensitivity and be sure that the client knows that they're supposed to take all their doses, and they may need to increase their fluids because that helps with the nausea, vomiting, and diarrhea. This is actually caused, all these GI symptoms are caused because this one is also killing those bacteria, and their little microorganism dead bodies have to come out somewhere. One big drug interaction that Cipro has is with respiratory med called theophylline. So cephalosporins, the one cephalosporin that we are going to focus on, and we're just learning generalized to specific here, is Ancef, and it treats life-threatening infections, or it could prevent infection for certain types of surgeries. The side effects of cephalosporins are easy to remember with this mnemonic system, the word giant. G for GI, like nausea, vomiting, or diarrhea. I for increased glucose values. A is for anaphylaxis. Or it could be for alcohol may cause vomiting. N is for nephrotoxicity. And T is thrombocytopenia. This is a very powerful antibiotic. It's used for multiple types of bacteria and represents the first generation of cephalosporins, and it can cause all of these giant undesirable effects. Tetracyclines. Tetracycline is actually the one that we're going to talk about. There are more, but it is the drug that we're going to stick with. The most common uses are acne and STIs, including syphilis. all kinds of sexually transmitted situations. However, this medication can also cause a superinfection. Again, we have the possibility that we could have a thrush situation, also known as yeast in the mouth. This one should not be taken with any kind of milk because that decreases its ability to absorb inside the body. It also has a possibility to stain the teeth if it's in an oral liquid form. So it could stain the teeth yellow, gray, or brown. And that's something that you really need to teach your patients, especially if, you're giving this to a child or somebody who is just having brand new, very pliable teeth. So down here in the side effects section, it says epigastric discomfort, diarrhea, heartburn. Photosensitivity, though, is one of the most important ones. You will have to remind them to wear a hat, maybe some sunscreen, and keep out of any sunlight if they can possibly do so. Aminoglycosides, the antibiotic that we're going to talk about is gentamicin. These ones are for some really tough, serious infections, but they have some tough, serious consequences also. Over here, it explains what some of those tough infections can be. I'm talking like Pseudomonas, Klebsiella pneumoniae, E. coli, Acinetobacter, and Staph aureus. It talks about on the slide meningitis and peritonitis. So some really serious conditions that we're going to be given gentamicin for. But it also causes these really serious side effects, adverse effects over here. Ototoxicity, nephrotoxicity. The oliguria is related to nephrotoxicity. Of course, it can cause pruritus, which is itching, urticaria, which is hives, and tremors. So we've got to watch for ear and kidney damage. This is one of the medications in which you're going to get a peak and trough so that you can monitor for these toxic levels. Next one, metronidazole, also known as Flagyl. You guys might have actually given this at clinicals. It's pretty common to be given. Okay, so if you can read the slide, it can be given for trichomonas, intestinal situations, liver abscesses, all kinds of really serious things here. It does say that you need to be aware that the side effects are headache, dry mouth, fatigue, metallic bitter taste, and GI distress. This is one that you cannot take any alcohol with. This is up to 48 hours after you've taken this medication because it's still in your system. No alcohol products, including mouthwash, aftershave, deodorant, and bath splashes. So we have to be very careful with that because it can cause adverse reactions. Sulfa drugs are another one that there are highly documented allergies related to these medications. The specific medication that we talk about in our learning this time is Bactrim. It's a combination medication that is used to treat things like UTIs, MRSA, and otitis media. The adverse effects or side effects that are related to this can be remembered by the mnemonic phrase SALFA, S being for sunlight sensitivity, U being undesirable effects such as rash or renal toxicity, L, look for urine output, fever, sore throat, and bleeding, F for fluids galore, so we're going to push fluids with this medication. Because of the renal toxicity, we want to rush it through those kidneys as fast as possible. And the A is for anorexia and anemia. Amphotericin B. This is a fungal medication. We are treating fungal infections. know that if this is given IV, a rapid infusion can cause serious side effects such as low blood pressure, low potassium, arrhythmias, and even shock. It can cause drug-induced leukopenia. We need to monitor kidney functions, and those labs, if you don't remember, are the BUN and creatinine. We need to tell the patient that they may have, adverse reactions such as fever, chills, hypotension, anorexia, 1 to 3 hours after starting an IV infusion. So it's not immediate when these reactions occur. Contraindications during pregnancy. Not a lot of medications can be taken during pregnancy. These are 4 types or classes that are contraindicated during pregnancy and why. And the letter M is relatively contraindicated. So that means that the physician is going to weigh the risks and benefits of that particular person's health and what their case is. So metronidazole can cause hepatic failure in an infant. Chloroprophenicol can cause gray baby syndrome. Aminoglycosides, ototoxicity. Tetracyclines are that teeth discoloration, which we've already talked about, and liver failure. And then in the small print over here, it says there are others. Nitrofurantoin, quinolines, and sulfamides, they're also contraindicated during pregnancy. Antitubercular medications. So tuberculosis is a serious disease. This slide shows you that there is a mnemonic phrase to help you remember the names of the medications related to tuberculosis, and that's RIPES. R for rifampicin, I for isoniazid, P for pyrazimide, ethinobutyl, and streptomycin. And each of these are connected with a specific effect. So each of them cause different things. But the thing about tuberculosis is they take 3 to 4 meds at once because this decreases the resistance of that tuberculin to medications. So they could be taking all of these at the same time. And they take up to 4 meds a day. And that's for 2 whole months. So they're taking all 4 of these for 2 months and getting all of these side effects. And then they go down to 2 medications twice a week for 4 to 7 months. And you can imagine with these long, drawn-out therapeutic processes that the patients become non-compliant after a while. And if they're non-compliant and don't finish their medication, because the tuberculins actually grow so slowly, they can actually cause that antibiotic resistance, and for the infection never to actually go away and just come back again. Just a side note here, that these can interfere with birth control as well as all antibiotics that we've talked about. So if your patient is on any antibiotic and is sexually active and takes PO birth control, and possibly IM birth control, they need to use a secondary method here. So encourage them to use some sort of blockade method would probably be best. So, do you know really what antibiotic resistance is? It is a huge problem, and due to the overuse of antibiotics, microorganisms mutate and resist the effects of drugs that were once able to kill them. So we have to continue to synthesize and regenerate new drugs to try to kill these stronger and deadlier bacteria. Here's a few causes of antibiotic resistance on this slide. It tells you again how it happens or why it happens. Overprescriptions of antibiotics. So there's a bunch of reasons you don't need an antibiotic, but people just feel better when they go to the doctor to get a pill. They didn't realize this was a problem until, recently. Patients not finishing their treatment. So if you're prescribed that 10-day treatment, take the 10 days of treatment. Overuse of antibiotics in livestock and fish farming. So this has actually been cracked down on also by the Food and Drug Administration. Poor infection control in hospitals and clinics, passing these infections over and over again to patients. Lack of hygiene and poor sanitation, which is improving in our country but not everywhere in the world. Lack of new antibiotics being developed. Antibiotics aren't exactly the money maker in the pharmaceutical world, so there are a lot of medications that make more money, so therefore are being developed more quickly. So antiretrovirals, we are on the path towards HIV and AIDS. A couple of these obviously can treat viral infections outside of the spectrum of HIV and AIDS, such as, well, I thought it was next, but Zovirax, we'll get there in just a second. The way the antiretrovirals work is they can either terminate viral replication, here, block DNA activity, or inhibit and prevent maturation of the HIV. And we talked about this when we talked about HIV in general. All of these somehow interrupt that retrovirus activity where it replicates itself and makes something new inside your body. These all cause side effects such as GI upset, headache, and rash. What doesn't? HIV attacks your T cells. Yeah, I know that you remember that, and uses them to make copies of itself. And see, there's its little baby. Copies and copies and copies until it takes over that T cell count. So here we are at Zovirax finally. So Zovirax can actually treat cold sores, shingles, chickenpox, and genital herpes, in addition to being given for HIV and AIDS. However, we can have a medication toxicity with this medication, and it can also cause nephrotoxicity. If we're given an IV, we're going to infuse over 1 hour. This is a symptom relief medication. It is not a cure, and you still need to be very sexually aware that if you have sex while lesions are present, that you can pass herpes on to someone else. These people who have genital herpes, even if they're getting treated, need to always wear a condom just to prevent that infection in their partner. So Fusion, this is an HIV and AIDS medication. It can treat bacterial pneumonia. It does have the possibility of causing a systemic reaction. It can cause a reduction of symptoms. It's not going to cause a cure of the HIV or AIDS. It also helps treat these opportunistic infections that go along with AIDS. It is unresponsive to other antiretrovirals. If we're having this medication, then they've been through treatment quite a bit. They've had no success with anything else. It's kind of a last-ditch effort to try to figure out what can help them. Maraviric. This medication for HIV and AIDS causes a bunch of effects. Most of these HIV and AIDS patients are on medications just to help them survive these antiretrovirals. It causes CNS effects, cough, upper respiratory infections, possibly an allergic reaction, and a huge hepatotoxicity risk, causing jaundice, right upper quadrant pain, and nausea. Retrovir, this is one of your drug definition ones. It can cause bone marrow suppression, lactic acidosis, hepatomegaly, GI irritation, and it has multiple drug interactions, as many of these do. Delvidarine can cause a rash, and that rash could lead to Stevens-Johnson's syndrome. This apostrophe S should be over here on Johnson's. But anyhow, it's a very severe skin reaction. It could cause flu-like symptoms and has multiple drug interactions, just like the last one. Also, CNS manifestations, including nightmares, insomnia, and if you take it at bedtime, this decreases those side effects. Norvir. This increases other I have no idea what that abbreviation was for. So forget that. It can cause osteoporosis, diabetes, elevated serum lipids, thrombocytopenia, caution in patients who already have a liver disease process, increased toxic levels of other meds, and give with food to increase absorption. Inestrus can cause liver injury. It's contraindicated in lactation, as many of these are, and it's caution in kids that are younger than 16. It's also cautious in older adults and people with existing liver disorders. So wash your hands to prevent all of these, and remember the difference between antibiotics and probiotics. And that is it. Thank you for suffering through my first video.